problem solving pharmacy میخوایم کیس ها رو بخونیم. تو تاپیک چی هستیم؟ anti-inflammatory. Patient with asthma complain at the purchase of salbutamol containing medicine به نام همون ونتولین اوهالر that the experience side effect tachycardia, headache, excitation. He just started to use this medicine. What shall we do? چیکار بکنیم؟ پس سالبوتامول گرفته، بعد همون موقع هم شروع کرده تاکیکاردیا، هدک و اکسایتیشن. In therapeutic dosage, severe side effects are unlikely. Probably his inhalation technique is incorrect, as the substance does not reach the lower airway and precipitate in oral cavity and pharynx. Application of plastic extender on the inhaler, learning the correct technique. آره تاکیکاردیا یه طرف گرفته، هدک و اکسایتیشن. خب سالبوتامول بتا
بلاگره اگه قلب بخوری تاکیکاردیا میگیری.
This short video will show you the right way to use your metered dose inhaler. Don't worry if your inhaler is a different color, it will still work in the same way. First of all, let me show you the parts of the device that I'll be referring to during this demonstration. This is the plastic case. This is the mouthpiece cover, which simply snaps on and off. This is the mouthpiece. This is the base. This is the canister that contains the medicine. Before you use the device, always check it inside and out to make sure that it's clean. You don't want any dirt, dust or fluff in the mouthpiece. If this is a new device, or if you haven't used it for a week or more, you'll need to test it. To do this, shake it well. Holding it away from you, press the top of the canister once to release one puff into the air. As you can see, it produces a fine mist. Now I'll show you how to use the device. The aim is to inhale the fine mist into your lungs. It may take a few goes before you get the hang of it. Just relax and don't rush yourself. At first, you might find it useful to use the device in front of a mirror. Begin by shaking the device well. Then hold it upright like this with your thumb on the base below the mouthpiece. Breathe out as far as you can without it feeling uncomfortable. Then, place the mouthpiece in your mouth between your teeth. Close your lips around the mouthpiece, but do not bite it. Start to breathe in as slowly as possible through your mouth. Just as you do this, press down on top of the canister to release one puff while still breathing in steadily and deeply. If you see mist coming from the top of the device, or the sides of your mouth, you're doing it wrong and you should start again. Hold your breath. Take the device out of your mouth and your finger away from the top of the canister. Continue holding your breath for a few seconds or for as long as you can without it feeling uncomfortable. If you are meant to take another puff, shake the device again and repeat the whole process. When you've finished, always replace the mouthpiece cover by snapping it back on. And that's it.
For full prescribing information and medication guide, please go to advair.com.
بعد میام بخاطر کیس 2 Asthmatic patient purchased steroid preparation and she is so hoarse. What do you recommend? حالا هورس یعنی چی؟ هورس اسب شده؟
دیگه اون مثلا اسبی شده سرفاش
خشن زمخت خرخر گرفته خیلی نامرتب. What do you recommend? With good inhalation technique and mouth washing after inhalation. With good inhalation technique 2 مرتبه و mouth washing دهنشو بشوره چون استروید پریپریشن گرفته. چرا؟ چون احتمال داره این استرویدات دپوزیت شده and can be avoided in the oral cavity which cause hoarseness and candidiasis هم باعث میشه. میبینی؟
یه قالچ هم بگیره دیگه. آفت بزنه دهنش تافت بزنه.
Oft.
تافت.
Patient purchase allopurinol, milurin, and some diuretic. What should you draw her attention for? Consuming plenty of water, which helps in uric acid secretion and prevent its crystallization.
چیکار کنه؟
مثل یه دیورتیک داره مصرف کنه، دارو مدر. خب حالا گفته که برای که هلپ کنه به یوریک اسید سکرشنش بایستی و پریونت میکنه از ریکریستالیزیشنش بایستی کانسیوم بکنه پلنتی آف واتر رو، چون دیورتیک داره آب بدنش رو میگیره. درسته؟ این باید چیکار کنه الان؟ بگو. یا لمه آب بخوره تا آب بدنش که گرفته میشه بدنش خوش بشه کریستالا رسوب نکنن، ریکریستالیزه نشه.
پلنتی یعنی چی؟
یعنی یه عالمه پلنتی آف واتر، یه عالمه آب بخور. Case report. Your pharmacy assistant, she suffered from eczema a long time ago. Mainly, her hands are affected. Frequent hand washing is required due to her profession. She has extremely dry skin. Topical steroid treatment hardly improved the condition. Changing the washing powder, cosmetic fabric softener did not resolve the issue. Her gum bleeds often. A special toothpaste did not improve. Allergy test showed metal silver allergy. نشون داده که اون به متال سیلور آلرژی داره. Allergiologist drawn her attention that the amalgamated dental filling contains mercury show cross-sensitization with silver. Changing the amalgamated filling in her teeth improves a lot in her condition and the complaints are disappeared.
یعنی با آمالگامه مشکل داشته از اول.
آره.
جلال خاله ما که نهیدم.
والا.
کجا خونه ما اون بزرگه؟
Case study 4. Patient would like to buy some remedy against diarrhea. She often suffers from this with bloating cramps. What can we recommend? یه مریضی چند تا رمدی خریده ضد چی؟ اسهال. She often suffers from with bloating. نفخ میکنه و کرم داره. چی بهش میدی؟ گفته referral is needed. باید بره دکتر. Can be suggested the trial of eliminating dairy product from the diet. مثلا lactose intolerance یا milk allergy داره. Patient should take some attention to clarify which factor cause or exaggerate symptom. In case of lactose intolerance, take care of ingredient of medicine. Enzyme substitution. The lactose chewing tablet بهش بدیم. و dietary advice. طرف علیه یه سری رمدیا و اینا اسهال میگیره بعد داره از بلوتنینگ و کرم هم رنج میبره برو دکتر. تموم شد. حالا اونو ببینیم.
Following this video will be important safety information about Advair. Hello. Welcome to this presentation on how to use Advair Discus. During the next few minutes, I'll go over the steps you'll follow to take medication from the discus, as well as cover some basic points about handling and caring for the discus. However, information in this video shouldn't take the place of the instructions for using Advair Discus found in the medication guide that comes in your prescription, or guidance from your healthcare provider. And be sure to talk to your healthcare provider or your pharmacist if you have any questions about your medication or use of the discus. Now let's take a look at Advair Discus. The discus comes in a foil pouch. Once you open the pouch and remove the discus, the medication has to be used in 30 days. To help you remember, there's a label on the front of the discus where you can write in the date you open the pouch and the use-by date, which is 30 days later. There's also a dose counter, and it shows you how many doses are left in the discus. It starts at 60 and counts down one number each time you use the discus. When you're down to the last 5 doses, the numbers turn red, and that lets you know it's time to replace the discus. Every time you get a refill, be sure to review the printed medication guide that comes with your prescription, since new information about Advair Discus might be available. Okay, let's walk through the steps for using the discus. There are 3 main steps involved. Open, click, inhale. And don't forget to close. And there are 3 key parts you'll use. The thumb grip, the lever, and the mouthpiece. When you first take the discus out of the pouch, the mouthpiece will be in the closed position. So our first step is to open and reveal the mouthpiece using the thumb grip. The way you do that is to hold the discus in one hand and put the thumb of your other hand on the thumb grip. Then, you'll push your thumb and the thumb grip away from you as far as it will go until the mouthpiece appears and snaps into the open position. That leads to step 2, the click. For this step, you'll use the lever, which prepares a dose of medication for you to inhale and makes the dose counter go down by 1 number. Therefore, it's important for you to wait until you're actually ready to inhale the medication before doing step 2. When you are ready, hold the discus in a level, flat position with the mouthpiece toward you. Then slide the lever back as far as it will go until it clicks. The medication is now ready to be inhaled. There are some key points you need to remember during this step so you don't release or waste doses of the medication. Don't close the discus until a dose of medication has been inhaled. Keep the discus flat and level at all times to avoid spilling or releasing medication. And don't move the lever more than once. Okay, let's get to step 3, taking an inhalation. Still holding the discus flat and level, keep it away from your mouth to avoid blowing air into the mouthpiece as you exhale fully. Remember, never breathe out into the discus. Then put the discus to your lips and inhale quickly and deeply through your mouth. Make sure you're breathing in through your mouth and not your nose. Once you've inhaled the medication, remove the discus from your mouth and hold your breath for about 10 seconds, or as long as it's comfortable for you to do so. Then breathe out slowly. The discus delivers a dose of medication in the form of a very fine powder. As the powder goes through your mouth and into your lungs, you may or may not taste or feel this powder. Even if you don't taste or feel the powder, don't take another dose. But do rinse your mouth out with water each time you inhale a dose from the discus. Be sure to spit out the water. Do not swallow it. You can now close the discus by putting your thumb on the thumb grip and sliding it toward you as far as it will go. The discus will click shut. This closes the mouthpiece and automatically returns the lever to its starting position. And that's it. The discus will be ready for the next scheduled dose, which will be about 12 hours later. You should take your Advair twice a day, every day, morning and evening, about 12 hours apart, as directed by your doctor. Some people take Advair when they brush their teeth in the morning and evening. This helps them remember to take it twice a day. You can review this video guide as often as you need to, but before we finish, there are some key points you should remember about the discus. When you're using the discus, hold it flat and level to avoid accidentally releasing or wasting medication. Be careful not to breathe into the mouthpiece. Never take an extra dose, even if you don't taste or feel the medication. After each dose, rinse out your mouth with water and spit the water out. Don't swallow the water. Keep the discus dry at all times. Never wash the mouthpiece or any part of the discus. Don't use the discus with a spacer device. And never try to take the discus apart. Thank you for watching. And if you have any questions, please talk to your healthcare provider or your pharmacist. For full prescribing information and medication guide, including instructions for using the discus, please go to Advair.com. Prescription Advair won't replace fast-acting inhalers for sudden symptoms and should not be taken more than twice a day. Advair is for people who still have symptoms on another asthma controller or who need 2 controllers. Advair contains salmeterol. In patients with asthma, medicines like salmeterol may increase the chance of asthma-related death. so Advair is not for people whose asthma is well controlled on another controller medicine. Talk to your doctor about the risks and benefits of treating your asthma with Advair. Do not use Advair with long-acting beta-2 agonists for any
Advair is
reason.
expensive.
If you are taking Advair, see your doctor if your asthma does not improve or gets worse. Thrush in the mouth and throat may occur. Tell your doctor if you have a heart condition or high blood pressure. Some people may experience increased blood pressure, heart rate, or changes in heart rhythm. Advair is for patients 4 years and older. For patients 4 to 11 years old, Advair 150 is for those who have asthma symptoms while on an inhaled corticosteroid.